Thank you all for joining us today. We are here for an important discussion on Medicare and upcoming changes in 2025. My name is Sarah Bryant. I'm the Senior Director of Marketing at the San Antonio Express News. Today, we're thrilled to be joined by two Medicare professionals. We have Brandy Gamboa, Director of Government Programs at Community First Health Plans. We have Stephen Vargas, Community Healthcare Director at Gonzaba Medical Group. Let's start with just a meaty topic because it's going to set our stage. We're going to do an overview of Medicare and patient support. What types of Medicare Advantage plans does Community First Health Plans offer? And then how do they differ from traditional Medicare?
Thank you, of course. So Community First offers a Medicare Advantage Alamo plan and a D-SNP plan. The Community First Medicare Alamo plan is an HMO plan. HMO stands for Health Maintenance Organization. Under an HMO plan, members will use doctors, hospitals, and other healthcare providers within our network. To enroll in our Alamo plan, you must be entitled to Medicare Part A, be enrolled in Medicare Part B, and live in Bexar County. By enrolling in the Alamo plan, you'll receive all the coverage you receive under your Part A and Part B, but you'll also receive Part D benefits and value-added benefits, such as over-the-counter benefits, which is basically a preloaded card in the amount of $175 per quarter that members can use for eligible over-the-counter products like cold and flu and allergy medicine, eye care products, foot care, and much more. We also offer non-emergency transportation. We want to ensure all our members are able to get to their doctor's appointments. So if they don't have a ride, they can contact the service and they get 70 one-way transportation rides. We offer meal benefits, so up to 60 meals per admission following surgery or inpatient hospitalization. We also offer dental, vision, and hearing benefits. Our dental benefit is about a $2,500 benefit limit for diagnostic and preventative services. Our vision covers $300 for benefit limit, and then we do cover $3,500 for prescription hearing aids. Our plans also offer fitness benefits through YCMA. You will continue to pay for your Part B coverage, but under Community First Health Plan's Medicare Advantage Alamo plan, you do not pay an additional monthly premium, and there is no annual health deductible. There are also low co-payments such as $0 for a primary doctor, $15 to see a specialist, and $25 for urgent care. Under our D-SNP plan, this is for people who qualify for both Medicare and Medicaid. This plan is a specialized coverage for dually eligible participants. These are for members in Bexar County and surrounding areas. The surrounding counties are Atascosa, Bandera, Comal, Guadalupe, Kendall, Medina, and Wilson. This plan also has no additional monthly premium besides your standard Part B and no annual health deductible. The benefits are similar to our Alamo plan with some slight differences. We have a higher coverage level for our vision, our prescription hearing aids. We have a higher benefit level for our non-emergency transportation and for our over-the-counter benefits. That's just two of the plans that we offer here at Community First related to Medicare.
Thank you so much. It's very comprehensive, and you broke it out so nicely. The idea of the gift card is very exciting. I love that. On the other side, in terms of a medical group, Stephen, how does Gonzaba Medical Group work with Medicare patients, and what are the services that are typically covered?
Yes, ma'am. It's a great question. So Gonzaba Medical Group works with several Medicare health carriers, and we accept about 6 Medicare Advantage plans here at Gonzaba. Now, the way it helps and it benefits our patients is through Gonzaba Medical Group. It is, of course, family-owned, physician-led. It allows us to do a lot of capabilities to make it as convenient as possible for the patient who is centered. Now, through these Medicare Advantage plans that we accept, Gonzaba Medical Group offers other services such as urgent care that's open 7 days a week, 365 days a year, from 8 in the morning to 8 o'clock at night. We also offer our physical therapy to our patients that is in-house. Plus, we do take care of all of our in-house specialists from endocrinology to podiatry. We have wound care. We have our own colon specialist doctor, of course. We also have our own, we've now added at Gonzaga that we're really excited about. We actually added our own care for acupuncture. Sorry, acupuncture. We have an acupuncture doctor here now, which has been really great to our seniors. Now, a lot of these services that we offer when a senior is on a Medicare Advantage plan that we accept, a lot of these services are done through the PCP level. So, we help them out a lot, especially on urgent care. If they come in, we understand those copays can be quite a bit of money for them. Seniors that are on a fixed income have a hard time with that. So we have programs here at Gonzaga Medical Group that we're able to help them with these copays. The same goes with physical therapy as another example. If a senior goes to physical therapy 3 or 4 times out of the month, that could be very expensive for them. According to what they have on their Medicare Advantage plan, depending on what copays they have. And like I said, with Gonzaga Medical Group as well, with these Medicare Advantage plans, we're able and provide the flexibility to where we can help the patient who is the center of the entire time they're here. We can help them with these copays, with the programs that we offer as well.
That's excellent. I'm so excited to hear that you guys have added an acupuncture, as my mom actually quit smoking with acupuncture. So it's amazing that you're adding different specialists, which is an excellent segue into our next topic of questions, and that's navigating doctors and networks. So it can be tricky, but I feel like, Stephen, in the way that you're describing Gonzaga, you have sort of a coordinated care. And so, how does Gonzaga assist patients in coordinating care with specialists or other medical providers within the Medicare system?
Yeah, great question. And that's a question that we get all the time here at Gonzaga Medical Group because of our coordinated care model that we offer, and the patient is truly centered when they become a patient of Gonzaga Medical Group. It allows us and gives us the flexibility to really work around the patient when they need to see a specialist. Just for an example, our acupuncture doctor, it's become really popular with us here at Gonzaga. She started off as part-time and it was so demanding for her that, we moved her to full-time. But, as we all know that sometimes when you're referring to a specialist like either an acupuncture, or an endocrinologist or podiatry, or rheumatology, I mean, whatever the case may be, they have to go through an issue of they have to schedule the appointments themselves. They have to first find availability. They have to check and see who's going to be able to take them. These are all things that come into an obstacle for a patient. And we try to eliminate all that by from the first time that we need to get them seen with one of our specialists. We have the capability to where our doctors can sometimes even just pick up the phone and send a text message to our in-house specialist and say, hey, I have a patient here that their sugar levels are really elevated and they need to see the endocrinologist ASAP. All we do is we just pick up the phone. What's the best time that you can come in? They tell us the time and we get them in as soon as possible. That's just the capabilities and the flexibility that we have here with Gonzaga Medical Group. Also, too, because of the network that we go through, our preferred network for specialists, it also gives our team the capability of scheduling these appointments for our patients at what's convenient to them and what's reliable to them, where they're going to have easy access to get there, to where the point where if they tell us, well, I don't know how I'm going to get to this specialist, even though they're a few blocks from my home, well, we can help coordinate transportation to get you there, and we try to do it around the patient. We're not going to send the patient from the south side of San Antonio all the way to 1604 and Culebra. That we don't work like that. It is patient centered, and we try to find a specialist around the radius of where the patient is, and if not in the clinic, the closest one near to them.
That's excellent. Yeah, navigating that can be really difficult. I think that you both mentioned transportation, that's absolutely something that is a benefit. Brandy, with community first health plans, how can beneficiaries determine whether their preferred doctors and specialists are in network so that coordination can happen?
Well, that's a really important question. A lot of our members, it's important for them to see the doctors that they need to see in the time urgency that they need to see them. So beneficiaries can determine if the preferred doctors and the specialists are in network by visiting our website, Community First Health Plans. They can also easily contact our member services department or speak to dedicated enrollment specialists at 833-434-2347. We have in-house dedicated members who are ready to help our members find the right doctor for them and find a doctor who can see them quickly. So that's what they do every single day. We're local, we're here, our call center is in-house, and we make sure that we assist our members with that.
Excellent. Thank you for providing that phone number. It's wonderful to have such resources. Um, So, speaking of resources, we're going to move on to our third topic, which is a hot topic within healthcare, and transparency is important, managing costs and benefits. So, I'm going to come back to you, Brandy. What are the key benefits and costs associated with enrolling in Medicare Advantage plan through your company?
Some key benefits of enrolling in the Community First Medicare Advantage plans are to include no additional premiums beyond the Part B premium, low or no co-payments for most services, and access to value-added benefits not covered by original Medicare. Our plans also are considered Medicare Advantage prescription drug plans, also known as MAPDs. This means our members have prescription drug coverage when they enroll in our plans.
Excellent. It can be costly and it can be confusing in terms of benefits. And I think that for those that are experiencing chronic conditions, and I'm going to come to you, Stephen, uh, how does Gonzaba Medical Group support that long-term care and disease management through Medicare?
Well, that's a great question. So, as we know, in San Antonio, there's a very high population with a lot of patients that are in chronic conditions like diabetes and so forth. Um, Being someone that's worked with Gonzaba for quite a while now, I've come across a lot of cases where it allows Gonzaba Medical Group, because of they are family owned and physician led, it gives us the capability and flexibility to work with these patients. um, Diabetes, for example, is one of the biggest chronic conditions here right now in San Antonio. And having to go see an endocrinologist for their diabetes can become very expensive. And that's a lot of times why they don't continue this care, because the co-payments can add up for them. And like I said, Gonzalo Medical Group has the capability with all the programs that we offer here to our patients with a Medicare Advantage plan, that we can help with a lot of those copays. So that way we limit that stress that they have on themselves of how are they going to get there? How are we going to pay? That's the last thing that we want them to have on their mind. We just want to make sure that we take care of the patient and that the patient understands that they are the center, and it is patient centered here at Gonzalo Medical Group. And at the end of the day, we just want them to walk away with a healthy experience and a peace of mind, knowing that we were here to help.
I think that it's so important that coordinated care and that it is patient centered. Uh, Sometimes when we're experiencing change, and this is going to get us into our fourth topic, which is impact of change, it can be so important for us to have that one contact, that one coordinated care moment, because change is hard to navigate through. So, how are the changes? And Stephen, this question is for you. How are the changes to Medicare in 2025 expected to affect any coordination of care between the primary care physician and then those specialists for those Medicare patients?
Yeah, that's a great question. And I guess that is what they can say. That's the $1 million question right now with all the changes that's going to happen for AEP for the annual enrollment period. And I go back to this all the time, with Gonzalo Medical Group, being that it's family owned and physician led, it gives us the flexibility and the available and the all the availability to offer these patients that are truly centered more. It doesn't limit them, if you can say that. It doesn't limit them to what they need or what their expectations are. I know that there are a lot of changes for this annual enrollment period with all the health plans coming in. Co-pays might go up, co-pays might go down. We're not sure. Prescription drugs, and so forth. But with Gonzalo Medical Group, I mean, and I keep going back to saying it, but it is truly patient-centered. At the end of the day, we just want to make sure that the patient is taken care of. So we're going to do everything in our power to make sure that we make sure that that patient continues the coordinated care that we follow, so that way we can help them through their lives, so they can have a healthy journey, right? So we offer all these programs that can help navigate us and help work around a lot of these adjustments that are going to happen for this annual enrollment period. And it gives us the flexibility to assist these patients when they come in regarding their copays, from whether they see physical therapy to urgent care, or they need to see an endocrinologist or an in-house, but any in-house specialist that we offer here, even to their transportation. It allows us to coordinate that with them and to make sure that they understand, hey, at the end of the day, we don't want price to be a factor. We want to make sure your health is taken care of.
Excellent. I wish that everyone was as coordinated in change as you guys are, because it would be helpful through a lot of different things in life. Um, and with the Medicare changes in 2025, there's some cool changes. So there's an introduction of a $2,000 annual out-of-pocket cap. And Brandy, for Medicare Part D, and there's some manufacturer discounts during both the initial coverage and then the catastrophic phases that affect costs and saving for the beneficiary. Can you talk a little bit about anyone enrolled in community first health plans and how those changes will impact that?
There is a lot of significant changes that are positively going to impact our members, and we are excited about them. We have definitely embraced them. In 2025, the new Medicare changes is that there's going to be a $2,000 cap on prescription coverage. That is a big deal. That means that after $2,000, our members are no longer going to have any out-of-pocket costs under our plan for prescriptions for the remainder of the year. And just as it is now, there is still a $35 cap on insulin. But of course, for our members, we have a lot of available options for their insulin coverage. We have insulin as low as $7 per month. So we are making sure that our members understand these changes. We're placing them on our website. We're sending notifications to them. And anybody who enrolls in our plan, our dedicated enrollment agents are going to make sure that they know about this information as well. So they know that they're going to be able to have significant cost savings this year coming up.
It's so awesome, as it can be so costly. I mean, it can be one drug is $500 a month, and then to know that you're going to have that cap and that you're only going to be spending $2,000, that's fantastic. So that's such a great change, and it's awesome that you also are a resource for change, and that can be a part of the beneficiary's journey as well. So we talked a little bit about drug costs, and actually that gets us into our next topic, which is future care and prescription drug costs. Brandy, are there any changes to your Medicare Advantage plans that can help members pay for the prescription drug costs?
Well, Community First Medicare Advantage Alamo Plan already features low prescription drug costs with no annual deductible for Tier 1 and 2 medications and a very minimum $200 deductible for higher tier drugs. But members pay as little as, like I mentioned before, $7 for a 1-month supply and $0 copay for preferred generic drugs. For 2025, members will experience increased cost savings under the Inflation Reduction Act. So they're going to have that $2,000 out of the pocket prescription drug cost cap. But in addition to that, they're also going to be able to participate in a Medicare prescription payment plan. It's known as M3P. What this means is if any of our members cannot afford their prescriptions up front, they're going to be able to pay monthly payments and still get their medication so that they don't go without it.
That is fantastic because, sometimes that $2,000 just isn't at our disposal. So having it in installments, that's great news. Um, we've talked a little bit about change and new, and I think that Stephen, with these changes, I'm thinking that there's got to be new preventative care or chronic disease management services that you offer through Gonzaba Medical Group. Can you speak to those?
Yeah, absolutely. Um, so we've added a lot of things here at Gonzaba Medical Group to help adjust with the all the changes for this annual enrollment period. One of them being, of course, adding a acupuncture doctor that offers that secondary choice of pain relief or stress levels or whatever the case may be, that we offer our patients here at Gonzaba, the acupuncture. Another thing that we pride ourselves on here too is that we also have, like I've said before, we have our endocrinologists that are available. We have our rheumatologists that are available. We have podiatry. We have wound care. There's just so much that we offer that we can offer the patient, and that we help coordinate the care for them through these Medicare Advantage plans that we accept here at Gonzalo Medical Group. So the long-term care, you know, um, it's just so helpful with us. One thing also too that we've added here at Gonzaba that we're very, very happy to offer is home health care now. That's one of the things that we're looking at for just another added portion to our medical group, is our home health care provider that we provide. And this is for our doctor to go out and see patients that are unable to get out of bed or unable to make it to the physician's office. We could send them out there so they can get seen, so they can make sure that they receive the proper care that they need.
That's excellent. So often chronic conditions then turn to homebound. So it's great to know that you have that service available as a part of that wraparound service. I want to talk a little bit about something that affects a lot of different seniors in their lives, um, Medicare fraud. So, Brandy, I'll kick it to you first. Is there any red flags that our audience needs to know about in terms of Medicare fraud, and steps that they can take to protect themselves? And then I'll go to Stephen.
So we want our participants, our community to be safe. So some of the red flags that they want to look out for is that no broker or agent should come up to you in a common area and ask you to enroll in our Medicare Advantage plans. They have to have permission to contact you. They can't make an unsolicited phone call or go to your door and just show up and say, hey, would you like to enroll? No, that's definitely a red flag. You do not want to give these people your personal information because that's how they can utilize it. You can always report fraud by calling one of the website, the Health and Human Services Office of the Inspector General. But overall, just make sure not to give out any of your personal information unless you contacted somebody or you have that permission to contact form ready and signed.
Really great tip. Stephen, are there red flags that you want to mention to our audience when it comes to Medicare fraud?
There is, and that's something that always comes up every year, and not even just during the annual enrollment period, but throughout the year with us here at Gonzaba, what they should look for, and just like Brandy touched on the red flags that they should be looking for. Those are accurate. Also, too, Medicare will never ever call you and ask you for your information, or ask you to disclose your social security number or anything like that. You'll always receive a letter from Medicare if there's any kind of changes or or if there an issue with something that they have, but they will never give you a phone call. And these are the scams that we want them to look out for out there, because we have people that we come across that have said they've been receiving a phone call or a text message, and or they get a phone call and they don't know they don't recognize the number, and they answer the phone and they hear a recording that says, "Are you so and so on the line? If yes, say if you are, say yes." And just by them saying yes, that right there opens the door for anyone to gather their personal information. So they never want to answer calls like that. And one thing that we do pride ourselves on here at Gonzaba Medical Group is we offer our patients, and not just patients of Gonzaba, but any person out there that's on Medicare, we offer them the assistance where they can give us a call directly if they have any questions, or they receive something in the mail, or they got a phone call and they don't understand. They can call us directly at Gonzaba Medical Group, and we can help connect them to an expert that can help guide them in all of their questions. So that way they feel they're not alone. Because during this annual enrollment period, it gets scary for a lot of seniors.
Right, I'm going to open it up to both of you. I'll start with Stephen and Gonzaba. In terms of resources, in terms of updates, are there resources available or places that they can go in terms of seeing healthcare coverage? What's relevant to their healthcare plans? Are there resources that you want to provide to the viewers for Gonzaba?
Yes, of course. There's plenty of resources out there. First, if they don't understand anything regarding their health plan and their coverages, Medicare, any questions they may have, they always can go to Medicare.gov. That is the most accurate information they're going to receive to help answer all their questions. Or they can reach out. We recommend that they reach out to their insurance broker if they do have their information, or they can always give us a call here at Gonzaba Medical Group at area code 210-610-4495, and we can help connect them with a licensed expert that can help guide them through this journey, through the annual enrollment period, to help answer any questions that they may have. So absolutely, yeah, they can always go. We have plenty of resources to offer.
Excellent. And then Brandy, resources.
So we want our members to know there's some important dates coming up, which is our annual enrollment period. It's from October 15th through December 7th, so we don't want them to miss out. This is our opportunity to enroll in a Medicare Advantage plan. Eligible enrollees can always check our website for the latest information, as well as our social media platforms. And our website is medicare.communityfirsthealthplans.com. Of course, they can just search Community First Health Plans and they'll find us. For one-on-one, face-to-face information, you can come to our Senior Citizen Appreciation Fiesta event. That's on November 1st from 9 a.m. to 12 noon at Progresso Hall. That is 1306 Guadalupe Street. Also, I feel one of the most important things that we have to offer as a local provider is that we can offer in-person dedicated assistance at our walk-in community office located in the historic Avenida Guadalupe neighborhood.
Excellent. That sounds like the best kind of care, both from Gonzaba and then from Community First Health Plans. I think thematically, we've seen that both of the brands will wrap around the care of the recipients of Medicare and for the patients of Medicare. And I just want to thank you both for providing your insights, for providing your brands, and for providing a really resourceful and an encouraging perspective on Medicare. Because as we mentioned in the beginning, it's confusing, it's hard to navigate. And so I think that the way that you've all presented today has just been so appreciative of those that are now experiencing new change and new plans in order to take care of themselves and their health journey. So I want to thank Brandy Gamboa, Director of Government Programs at Community First Health Plans, and Stephen Vargas, Community Healthcare Director at Gonzaba Medical Group. And also direct people to mysa.com/Medicare for more information. And we will also have links to the resources that Brandy and Stephen mentioned.